Hi everyone, we're here to present our value proposition for a biocompatible suture implant to improve hernia repair. I'm Emily.
I'm Nick.
And I'm Kristen.
For the clinical need for our device, there are approximately 800,000 inguinal hernias every year, and 80% of these cases are ambulatory, meaning that they require emergency surgery.
With that said, the golden standard for this device is to be a prosthetic mesh that will be a reinforcement of the hernia site, and it's implemented laparoscopically, which means there are 3 small incisions compared to an open procedure, which is a 5 centimeter incision.
The gold standard isn't without flaws, however. These meshes typically aren't bioabsorbable, so they can last within the body indefinitely, leading potentially to fibrotic encapsulation and other complications. The mesh, when it's inserted, isn't under any tension, and due to that, it has the risk of migrating to other sites away from the injury site, allowing the hernia to ultimately recur. And then it poses a risk of infection to surrounding tissues due to abrasion primarily. For our approach, we're looking to design an augmentation of the current mesh design, coating the mesh with an RGB peptide to encourage cellular induction, and ultimately promoting faster healing of the surgical site. We're looking to incorporate a cellular scaffold into the fibers themselves, again promoting cellular migration and overall integration of this material into the surgical site while it heals cellularly. And then we're looking for the mesh to ultimately absorb into the body, so we're looking to make it out of bioabsorbable material, allowing the ultimate repair site to be cell-based and not due to a foreign construct such as this. We're looking for compatibility with the current laparoscopic procedure that the surgeons are familiar with. And we're looking for barbs on our mesh to anchor it to the abdominal wall, preventing migration to other sites. As you can see here, it is an augmentation of the current design, so it's a familiar mesh network with each of the fibers being constructed of a cellular scaffold, promoting that cellular migration and integration. And we're looking to coat all these fibers with an RGB peptide, encouraging cellular induction. And then you can see the barbs on the ends of the fibers themselves, allowing the mesh to be implanted and be immobile, preventing its migration to other sites.
For our cost and benefit analysis, our technique will be used laparoscopically, which means that the surgery will be less invasive, and laparoscopic surgeries also reduce readmission rate, which means that patients will save money because they won't have to pay for an additional surgery. However, this technique is longer and more expensive and has a greater learning curve for surgeons. Our device will promote the healing of the inguinal canal, be fully bioabsorbable, and allow for cells to heal. And the mesh will also not move because of the barb design, and will decrease the risk for implant infection because fibrotic encapsulation will be less likely to occur. However, there is still a risk of incision infection when the surgery is performed, and our device will be a Class 3, meaning that we have to go through the FDA approval process.
So finally, there are 3 main competitors that already have hernia meshes in the industry. The first is Medtronic, where they have over 5,000 micro barbs that connect the tissue to the mesh. This allows for the limited use of adhesives as well as tacks. It's also 40% bioabsorbable, which allows the patient to feel more comfort as it stays within them through their lifetime. As for Ethicon, they use a pig-derived matrix, which allows for reinforcement of strength, and its open pore structure influences cell migration, revascularization, which is very important for the patient to heal properly and limit infection. Finally, the barb mesh is created with microfilament fibers, which also limit infection, and they have a specific coating to them. And then they're 60% lighter than any other device in the market, which also allows the patient to feel less restricted and have more free movements of the intestines. And it also influences fibrostic tissue responses to allow for further growth. Thank you.
Thank you.